Good morning, everyone. Myself, Dr.P.Sivakumar, Professor cum HOD, Pharmacy Practice Department, Prime College of Pharmacy, Palakkad. Today, I am going to discuss about therapeutic management of tuberculosis. So, before entering the topic, you should know about what is tuberculosis, how it can spread to one person to another person, then what are the diagnostic method it will be helpful for identification of tuberculosis. First, the tuberculosis is an infectious disease most commonly affect the lungs. It not only affect the lungs, but it can affect all the parts of the body. The main causative organism of tuberculosis is Mycobacterium tuberculosis. Some other species also which can influencing to cause the tuberculosis. For example, Mycobacterium bovis and Mycobacterium africans. So coming to the epidemiological data, in 2016, so there were an estimated approximately 10.4 million new cases were diagnosed in worldwide. Out of that, 6.4 were men and 4.2 million were female. So why we are giving the more importance for tuberculosis means the tuberculosis is one of the top 10 causes of the death in worldwide. So especially the death it will be occur due to antimicrobial resistant and the leader killer in the people with HIV infection. So coming to the type of tuberculosis, mainly they are categorized into two type. One is a pulmonary tuberculosis, another one is a extrapulmonary tuberculosis. The pulmonary tuberculosis means the mycobacterial tuberculosis infection which can be developed or which can affect only in the lungs. That is called as a pulmonary tuberculosis. Suppose the infection which can be developed apart from the lung, other organs of the body, that is called as a extrapulmonary tuberculosis. In pulmonary tuberculosis, again it will be divided into primary tuberculosis, another one is a secondary tuberculosis. The primary tuberculosis means which can occur once the organism which can enter into the body, our body cannot able to defend against the mycobacterium tuberculosis. So such a condition it is called as a primary tuberculosis. Especially it will be developed elderly peoples and as well as immunocompromised patients. Then coming to the secondary tuberculosis or otherwise it is called as a reactivational tuberculosis. Extrapulmonary tuberculosis, it's apart from lungs, other organs can be damaged. Okay, so secondary tuberculosis, I told it is a reactivational tuberculosis because already the primary lesions which can present that can be reactivated when our immune system will compromise. Okay, so coming to the extrapulmonary tuberculosis, the most common extrapulmonary tuberculosis type is lymph node tuberculosis, pleural tuberculosis, then abdominal tuberculosis, pericardial tuberculosis. So many type of extrapulmonary tuberculosis it will be there. Then coming to the mode of transmission, how it can be spread from one person to another person means there are 4 route of transmission it will be there. One is a inhalation of organism, then second one is a ingestion of organism, then third one is a inoculation of organism, then fourth one is a transplacental route. So inhalation means, for example, we can say self-swallowing of infected sputum, or otherwise what it called, if there is any infected sputum, it can be present in the outside, that can cause the inhalation organism, it will be happen. Then ingestion of organism, the classical example is a Mycobacterium bovis, because the infected cow milk, if we are not properly boiled, suppose we are taking the same milk that can cause the intestinal tuberculosis. So then third one is a inoculation of organism, and fourth one is a transplacental route. It is a rare method, mode of transmission. So coming to the spread of tuberculosis, there are four different types or four mode of spread of tuberculosis. It will be occur. One is a local spread, then the second one is a lymphatic spread, then third one is a hematological spread, then fourth one is a natural passage. Then coming to the sign and symptoms, so the tuberculosis means the classical sign and symptom is a persistent cough for approximately 3-month continuous cough. It will be present. Then chest pain, it will be the elevation of the body temperature, then especially sweating in the night time, then weight loss, it will be occur. So these are the classical sign and symptom of the tuberculosis. So for coming to the diagnosis part, they are using a different method of diagnosis. For example, bacteriological method, sputum culture techniques, then radiography, then nucleic acid amplification, then tuberculin skin test, then other biological examination. So with the help of diagnostic, these are the technique which can help to diagnose the tuberculosis. So coming to the treatment part, so this is the main part of our topic. So in our country, then tuberculosis especially treated with the guidance of revised National Tuberculosis Control Program. Guidelines are used for the management of tuberculosis in our country. So what they are suggesting means for the treatment of drug sensitivity tuberculosis case, they are suggesting thrice weekly regimen are adopted under the RNTCP, that is a revised National Tuberculosis Control Program. So although sometimes require for the diagnosis, surgery plays a minor role in the treatment of extrapulmonary tuberculosis. For extrapulmonary tuberculosis, the treatment given at least 6 months with anti-tubercular medication. Okay, suppose the extrapulmonary tuberculosis which can affect in central nervous system means additionally we need 3 months of additional treatment. So RNTCP, that is a revised National Tuberculosis Control Program, has released a national strategic plan for tuberculosis 2007 to 2018 for the control and elimination of tuberculosis in India by 2025. So what are the drugs which they are used in the treatment of tuberculosis means they are categorized in several types. So first line therapy, then second line therapy, it will be there. So first line therapy that also subdivided into 3 groups. The first one is what it called first line oral anti-tubercular drug. For example, we can say isoniazid, rifampicin, pyrazinamide, ethambutol. So these 4 drugs which coming under oral anti-tubercular drug. Then second one is injectable anti-tubercular drug. For example, streptomycin, amikoxin, kanamycin, capromycin. These 4 drugs are coming under injectable anti-tubercular drug. Then third group, that is called as a fluoroquinolone derivative. For example, ofloxacin, ciprofloxacin, moxifloxacin, and what it called ofloxacin. These are the classical example for the fluoroquinolone derivative. These are all the first three groups which can be coming under first line therapy. Then second line therapy, so that is for example ethionamides, prothionamides, cycloserine, and these drugs are coming under second line oral anti-tubercular drugs. Certain drugs are uncleared efficacy, for example linozolid. These are the examples are coming under uncleared mechanism, how the drug which can be control the multiplication, and as well as how the drugs which can kill the tuberculosis, we don't know exact mechanism. Coming to the continuation of management, so the DOTS therapy, that is a directly observed treatment short course. So that was introduced in the year of 19, or it was launched in the year of 1997. That will be launched with the help of revised National Tuberculosis Control Program. So the main motto of DOTS therapy, so it can be defined means watching the clients swallowing the each dose of anti-tubercular drugs. So what are the advantage of this therapy means, first thing we can say, the patient they can completing the course regularly. The second thing, we can reduce the spreadability from one person to another person. Third thing, we can reduce the risk of drug resistance. Then fourth one, we can reduce the treatment failure and relapse. So based on that, they are achieving the number of reducing the number of spreadability and as well as the number of death rate also. So coming to the same DOT therapy, so there is a intensive phase, it will be there, continuous phase, it will be there. So usually intensive phase, if the patient is diagnosed newly, means the intensive phase they are taking 2 months in the combination therapy of isoniazid, rifampicin, pyrazinamide, ethambutol combination. Then continuous phase they are taking the 2 drug regimen, for example isoniazid and as well as the what it called pyrazinamide. So 6-month therapy they are using. Suppose if the person having a comorbid condition, or if the person is suffered along with tuberculosis along with HIV infection, or the person having a pregnancy condition, suppose the infected patient is pregnant condition, means the duration of the therapy it will be increasing. So thank you.